Hello, my name is Raya Haghverdi, and my project is on Smartwatch Gynecology, gestational diabetes in the Hoosier moms cohort. So gestational diabetes mellitus is an adverse pregnancy outcome that can occur to pregnant patients, but the effects of it can last beyond the length of pregnancy. Those with GDM not only experience painful symptoms during their pregnancy, but also afterwards, as they're more at risk for developing type 2 diabetes. Their children, on the other hand, are also more likely to experience diabetes and a variety of neurodevelopmental and motor disorders. While tracking for this illness is prevalent in hospitals, the tracking and diagnosis only happens around 22 to 28 weeks gestation, which is pretty late in the game. Also, the methods of finding out whether someone has diabetes is usually obtrusive. Either it regards a blood test, drinking something nasty, or it's just a burden to come to the clinic every day. So we decided to find a solution to this issue using wearable technology. Our research question was as such: how can metrics collected on smartwatches, which are very versatile and convenient devices, be used to predict or analyze adverse pregnancy outcomes like GDM? Our methods included doing an analysis on the Hoosier moms cohort. This was a group of 406 high-risk participants based on their BMI. The participants came in for multiple visits, but we looked at the first three, two of which occurred during pregnancy and the last one during delivery. In particular, I was interested in the heart rate and stress metrics to see if any of those would have correlations to clinical data or GDM diagnosis. As stated, we had two different kinds of data: clinical data, as I mentioned, and the wearable data. Our clinical data included hemodynamics, systolic and diastolic pressures, and resting heart rate. And we also had the Edinburgh Postnatal Depression Scale, which was taken at visits 1 and 2 to screen for depressive symptoms. We also had wearable data from each participant as they wore a Garmin Viveo Smart 4 watch for a variable number of months, as pictured on the right. And we had heart rate data, which was collected in beats per minute, and stress scores, which were a measure of heart rate variability. The lower variability was, the higher the stress score was. So after consolidating all the information from the users, we looked for any relationships to each other, as in clinical versus wearable, and also to GDM diagnosis. So our preliminary results show that there were significant relationships between GDM and hemodynamics in all three of those metrics. To do this analysis, we did a binary logistic regression, and we found that all of these metrics from the visit 3 were significant when compared to the diagnosis of GDM, and our sample size was 20 in this analysis. As we can see, as systolic pressure increases and as heart rate increases, the likelihood of a GDM diagnosis decreases, and the opposite is true for diastolic pressure. We also compared the wearable stress data to items on the Edinburgh Postnatal Depression Survey. A higher stress score indicates higher stress. And to do this, we conducted a multivariate ordinal regression with our 39 participants. We found that in general, as trimester 2 and trimester 3 mean stress increased, the response on item 5 on the EPDS also increased. This is only in regards to responses collected on visit 2. So as you can see in our box plots, while there is a lot of variance in our data, the general trend shows that stress goes up as item 5 response goes up from a scale from 0 to 2, which also indicates a greater prevalence of depressive symptoms. So what are the implications of all of this? Well, our research means a lot of things. It means that there are relationships between GDM and easy to track clinical data. It also shows that stress has correlations when it compares wearable data to clinical data. So our data can help support any kind of predictive model already put in place for GDM and can lend data to go towards figuring out more about other adverse pregnancy outcomes, such as pregnancy anxiety and depression, as well as anything else that might be tracked by heart rate variability or heart rate. So there are a lot of ways and directions we can go with our data, but we're hoping that more wearables will be introduced for wider populations to get a greater idea of how wearables interact with clinical data with all kinds of people. So lastly, I would like to thank the team for helping me: Anna Heintzman, my fellow REU, Alexander Hayes, our graduate student mentor, and Kate Connolly, our faculty mentor. And special thanks to the NSF and IU Grand Challenges Precision Health Initiative for the funding. And I'm happy to take any questions at my email listed in bold. Okay. Okay. So hi, my name is Anna Heintzman. I want to thank Raya for that lovely introduction. So I'm also going to be talking about our project, Smartwatch Gynecology, specifically respect to gestational diabetes in our study group, the Hoosier Moms Cohort. So let's imagine for a moment that you have decided to have a baby. It could be just you, it could be you and your partner, or your partner could be the one having the baby. Either way, there's a lot of problems, the main one being it's really difficult to know exactly how lifestyle changes during pregnancy will affect you and your child, especially until that child is actually brought to term. You have so many questions. So like what habits you should change or adopt? When will these begin to affect you and your child? How big will the impact be? How expensive will it be? And the list goes on. And you're at a lack for a solution. But this is where our work comes in. So our research focuses on addressing how health information from commercial wearable devices can be used to predict risk for adverse pregnancy outcomes. In recent years, wearable technology especially has taken off, especially with commercial wearable devices, so like Apple Watches, Fitbits, and the Garmin smartwatch that you see here. It is the smartwatch that we used in our study, the Garmin Vivo Smart 4 watch, and they're able to track various different health data like heart rate, sleep, stress, and blood oxygenation in the case of our study. Specifically, heart rate and sleep especially are two variables that have been closely correlated to adverse pregnancy outcomes. So we are looking to study these variables with greater depth and relate them to gestational diabetes in our particular research. So our study focused on collecting two main types of data, namely being clinical data and wearable data. As mentioned before, the wearable data was collected using the smartwatch, and it started just before the end of trimester 1 at around the first clinical visit. Clinical visits occurred throughout pregnancy as well as postpartum. At the different trimesters. So one towards the end of the first trimester, beginning a second, and a second, beginning a third, and so on. At these clinics, we collected different survey data, demographics data that differed depending on which visit it was, and a few are listed here. So the final product currently is some correlations or significant correlations that we found between the variables collected in the clinic and by the smartwatch and gestational diabetes mellitus diagnosis in the participants. Age is just one of these. As you can see, as participant age went up, so did their likelihood to develop gestational diabetes. Eventually, what we hope to produce is a predictive model in which we take the variables and everything that we found to have significance in our study thus far, so like age, for example, and then we put them in a predictive model similar to the one shown here, which is an example of a neural network, although it could be a decision tree or a gradient boosting machine, anything like that. And eventually, we're hoping to be able to predict an individual's risk for developing gestational diabetes in the end. Ideally, we'll be able to use these predictions to estimate an individual's risk for adverse pregnancy outcomes and then intervene or encourage lifestyle changes in order to ensure that these issues don't develop later in pregnancy. I'd like to thank my team, Raya, of course, as well as our PhD student mentor, Alexander, and our faculty mentor, Kay.
as well as the ProHealth research experience for undergrads, the Precision Health Initiative, and the National Science Foundation for the funding for our work. Also, please do not hesitate to contact me should you have any questions. Thank you so much.